Well, it's time for our health segment now, and we're joined by our In Focus Health correspondent, Lenore Madu. Hi, Lenore.
Hello, Dimiaki.
You have some promising news on the vaccine front, right?
That's right. A new meningitis vaccine is prompting a new vaccination drive across West Africa. The vaccine provides protection for 10 years against the disease. Health workers in Mali, Burkina Faso, and Niger are preparing for countrywide vaccine campaigns set for December. The three countries just concluded a limited pilot phase. The meningococcal vaccine was developed by the Serum Institute of India under a partnership with the World Health Organization and the NGO PATH. Pneumococcal disease, is a leading cause of serious illness in children and adults throughout the world. Now, Rwanda has added a pneumococcal vaccine to its infant immunization program, I can say that, the first developing country to do so. It's early morning at the Nyamata Health Center in Bugesera district in Rwanda. Young mothers have brought their babies to the clinic to have them immunized against pneumococcal disease. John Heldrup is Senior Program Manager of the Eastern and Southern Africa with the Gavi Alliance.
The really exciting thing here in Rwanda, and what we want to show the rest of the world, is that Rwanda has successfully introduced pneumococcal vaccine in 2009, in April 2009. And we are really here to see the first results of that.
Pneumococcal disease is the biggest vaccine-preventable killer of children under age 5. Medical personnel in clinics and hospitals around the country say they have noticed a decline in infection rates. Françoise Kanani is a nurse at the Nyamata Health Center.
Before the introduction of this vaccination program, we used to have cases every month related to pneumonia. But ever since the introduction of this vaccination program, we have realized a decrease in cases. We can often have a whole month without a single case.
This ward we are standing in is actually showing part of the result, because as you can see, there are a number of empty beds here. This is the department where you have all the kids with respiratory tract infections, and we can see that many of the beds are empty.
Vaccination levels in Rwanda are now at 90%, reaching young mothers in rural areas. The mothers are also given lessons in health, hygiene, and child care.
My hope for my child in the future is that he grows up healthy because he has been vaccinated, and he will be able to go to school and do things that will develop the family and the country in general.
The pneumococcal vaccine also protects against strains of meningitis and septicemia and may save the lives of 6,000 children under 5 each year. And experts say Rwanda is one of the few countries in sub-Saharan Africa that is on target to meet its Millennium Development Goal on infant mortality.